This short module is designed to provide a simple approach for explaining the myDNA and genomic diagnostics pharmacogenomic reports by use of a mental health case study. Our case study is a 38-year-old female with long-standing history of treatment-resistant depression with increased sensitivity to side effects. She has trialed different antidepressants to treat her depression, including the SSRIs paroxetine and fluoxetine, without significant improvement. The most recent prescription was for venlafaxine, and side effects were still problematic, and was then referred by her GP to a psychiatrist for assessment and management. The psychiatrist ordered a pharmacogenomic mental health test to assess the patient's metabolism profile for the current antidepressants in clinical use. The patient provided a blood sample and pharmacogenomic lab testing was carried out for the pharmacogenomic mental health panel. The psychiatrist received the pharmacogenomic mental health ultra report through his pathology system. The report provided a summary of the test findings and the potential clinical issues for antidepressants and other mental health medications. The psychiatrist is quickly informed of the patient's pharmacogenomic test results and the antidepressants which are predicted to have a significant change to their metabolism and the potential clinical effect. The psychiatrist can see that venlafaxine's metabolism is significantly affected and the patient is at an increased risk of adverse effects, which is consistent with the clinical picture. The psychiatrist can also see the group of antidepressants that are most suited for this patient, where normal metabolism is predicted and standard dosing is advised. The psychiatrist was interested to read a little more into the detail of these findings and uses the link at the top of the ultra report to access the full mental health PDF report via their myDNA doctor portal. The psychiatrist then downloads the pharmacogenomic mental health full PDF report and reviews the detailed interpretation around venlafaxine and the clinical recommendations provided by the current international pharmacogenomic guidelines. These guidelines suggest to select an alternative antidepressant to venlafaxine. The full PDF report also provides the psychiatrist with the list of antidepressants with usual prescribing considerations that are best matched to the patient's metabolism profile, and then decides to switch the patient using this information from venlafaxine to escitalopram using the recommended starting dose as per the current CIPIC pharmacogenomic guidelines. The patient returned to the psychiatrist for her 4-week review, feeling much better with minimal side effects reported.